Hi everyone, welcome to the channel The Dental Scholars. Today about the topic the cyst. Cysts are the most common cause of chronic swellings of the jaws. They are common in the jaws than any other in the bone. Why do you think they are more common in the jaws? Because in the jaws, remnants or remaining elements of the odontogenic epithelium are present. These remnants are the cells which does not take part in tooth formation and will be present around the tooth after its development is complete. Cyst formed from this epithelium is called as odontogenic cyst and accounts for most of the cyst of the jaws. Odontogenic cysts and tumors form an important aspect of oral and maxillofacial pathology. Coming to the definition, Kramer in 1974 has defined a cyst as a pathological cavity having fluid, semi-fluid or gaseous content and which is not created by the accumulation of pus. Most cysts, but not all, are lined by the epithelium. Why do you think cyst is a pathological cavity? Because the term pathological means not normal. So, odontogenic cysts are not found in normal conditions. Only if some abnormal activity takes place, it will lead to a cyst formation. Cysts of the oral and maxillofacial tissues that are not lined by the epithelium are the mucous extravasation cyst of the salivary glands, the aneurysmal bone cyst, and the solitary bone cyst. These may arise from the connective tissue. Parts of a cyst includes wall, which is made up of connective tissue, epithelial lining, and formation of cyst. Development of a cyst generally takes place in three stages, that is, initiation, formation, and enlargement. Initiation, most cystly due to assimilation of epithelial cells which are present around the tooth structures as remnants. These remnants proliferate, means increase in its number, but it does not enter or invade adjacent structures, that is, jaws. As these remnants proliferate into a solid mass, the epithelial cells, remember please that the remnant consists of epithelial cells, in the center becomes far from the blood supply present at the periphery of the mass. This later develops into a cyst. These remnants can be either cell rest of malaces, which are part of periodontal ligamental cells, or cell rest of serraces, which are remnants of dental lamina entrapped within the gingiva. Coming to the formation. Formation, at some point, cells present in the center die, creating a lumen or empty space. The intercellular space of these dead cells make the lumen hypertonic, which means the concentration of intercellular products of these dead cells is very high in the center. So, in order to balance this high concentration in the lumen, the fluid present around the cells and blood vessels in the periphery fills the lumen. This in turn causes bone resorption, clinical expansion, and sometimes mild paresthesia or pain. Coming to enlargement, because of continuous proliferation of these epithelial cells, the cyst will enlarge. And the cyst enlarges, it compresses surrounding connective tissue, which becomes a wall of cyst later, and the outermost epithelial lining matures and develops into a basement membrane. A variety of factors may come into play which contribute to subsequent growth and enlargement of the cyst. Coming to the formation of the inflammatory cyst, the following mechanism is involved. Inflammatory cysts are the results of inflammation and presence of inflammatory cells. The periapical cyst, in contrast with the developmental cyst described above, in inflammatory in origin. These are extremely common lesions found at the apex of teeth. They develop as a result of long-standing pulpitis or dental caries. The inflammatory process may result in necrosis of the pulpal tissue, which travel across the length of the root and exit an apex of the tooth into the surrounding alveolar bone, giving rise to a periapical cyst through the process described above. Generally, there are two types of cyst, that is a true cyst and a pseudocyst. True cyst, which is lined by the epithelium, example the radicular cyst, and pseudocyst, which is not lined by the epithelium, example aneurysmal bone cyst. Classification of cyst by shear. The cyst is classified into three main headings, that is the cyst of the jaws, cyst associated with the maxillary intrum, and the cyst of the soft tissue in the mouth, face, neck, and salivary glands. The cysts of the jaws are divided into those that are epithelial lined and non-epithelial lined. The epithelial lined cyst may be either of developmental origin or inflammatory in origin. Cyst of developmental origin may be either of odontogenic or non-odontogenic. Odontogenic meaning arising from the odontogenic tissues, non-odontogenic meaning cyst arising from the ectoderm involved in development of the facial tissues. Remember, odontogenic means arising from odontogenic, that is development of tooth. Common clinical features of cyst of the jaws. Usually they are slow glowing and usually displaces teeth rather than dissolving teeth. They are symptomless unless infected and are frequently seen during radiographic findings. They are rarely large enough to cause pathological fractures. They form a compressible and fluctuant swelling, it extending into the soft tissue. They appear bluish when close to the mucosal surface. Radiological features in developmental cysts. They are unilocular radiolucency associated with the crown usually, and radiological features in inflammatory cysts, round or ovoid radiolucency with radiopaque border circumscribed. Histopathological features. Sometimes aspiration is used in aid diagnosis of a cystic lesion. Example, fluid aspirate from a radicular cyst may appear straw colored and display shimmering due to cholesterol content. Almost always the cyst lining is sent to a pathologist for histopathological examination. Required, this is usually by the surgical removal of the cyst. There are 4 ways in which cysts are managed. 1. Enucleation, removal of the entire cyst. Marsupialization, the creation of a window into the wall of a cyst, allowing the content to be drained, and the window is left open, and the lack of pressure within the cyst causes the lesion to shrink as the surrounding bone starts to fill in again. Enucleation following marsupialization, and the last one, enucleation with curettage. This is the removal of the cyst and some of the surrounding bone which may contain some of the lining of the cyst. Listening. Hope it's useful for you. Thank you. Please do like, share, and subscribe to our channel, The Dental Scholar. Thank you.